So did you know that scientists have found in some of our older teenager and young adults there are horn growing in the back of the children's skull? And a lot of this has to do with the little kiddos have long exposure to using electronics, so their head always tilted over. So their skull start developing this little horn to kind of help them balance with them constantly looking down. So this is something that is alarming, and it is showing that your body is constantly evolve. Some might be good, some might be bad, just to trying to help your body better acclimated through all this modern technology. So today we are going to talk about things that we are doing that are modern technology that somehow have long-term impact on your children. And I think the most important thing as parents is that we want to do the best that we can for our children. But sometimes we don't realize that little things that we culturally consider normal have very long-term detrimental effect on our children. So we will talk about that a little bit, and hopefully what you get is that all this information to help your child grow better long-term. What we created is this little pamphlet. And what this pamphlet is basically a summary of everything that we wanted to talk about. We give this to all parents with little infants because we want you guys to know about these informations. And then this video is just trying to give a little bit more in-depth explanations of why we recommend these things to integrate, to avoid, or to minimize the use of. So of all the modern habits that I have seen that in a modern society that we are doing that is so detrimental and a lot of parents doesn't know about is basically the use of pacifier. The use of pacifier cause a lot of issues with your child growth and development, especially the skull development during especially the first 2 years of their life. So what is self-soothing? So all self-soothing is when your child is crying, there is a little spot behind the area where the two front teeth are supposed to be. When they are pushing on that area, it's going to release a dose of oxytocin. And when a child learns to self-soothe, this is what they're doing. They learn to kind of lifting that tongue up to that area and pushing on it. And what it does is it gives this oxytocin and will calm your child down. However, whenever you introduce the use of pacifier, that will interrupt that process of self-soothing. And the reason why we want to encourage self-soothing is during the process of self-soothing, it will teach the body to encourage the tongue to go to the roof of the mouth. And why do we care about that? When the tongue goes to the roof of the mouth, it helps the arch on the top expand and grow in a normal, correct pattern on there. And when your arch on the top is growing, what it does is it affects multiple things. It affects how your child is breathing because it is the base of the nose. It will affect the way that the tension, the muscle strength of the upper respiratory is training those muscles to be stronger. So your child will have a better capacity of breathing through the nose. And this also will teach your child how to swallow correctly. So they eating in a timely manner, they are not have all this adverse to certain food, and also it's protect the TMJ. That's why we really encourage this pattern of self-soothing because it really helps develop a long-term habit for your child to grow correctly. But now we're looking at, let's say we introduce the pacifier. These are the wubba and these are the favorite of most young moms. And this shape is also the one that they send you home from the hospital. The reason why I don't like this is, first of all, it really interrupts the way that your child is self-soothing. It is really hard. It doesn't require your child to move their tongue up very much in order to cause that release of oxytocin. So it's a lot more addictive. It will make the tongue very lazy, not moving up where it's supposed to be, and it's interrupt their swallowing pattern. They will turn into, instead of swallowing correctly, they will go into what we call the reverse swallow, infantile swallow, or a tongue thrust. That will have a lot of detrimental effect down the line. If a child come to me older than 6 months, if they have any kind of oral habit, I will see this indentations in the arch of the mouth, because 60% of the head and neck growth is done by age 2. So what that means is the bone is extremely malleable. It will shape around whatever you put in there. And you can come to me and I can tell you which pacifier they are using, or they're using their thumb. If all possible, avoid this unless your nurse practitioner is asking you to use it just to train them learn how to latch. I much prefer the Nook or the mom's pacifier. So we are going to compare all these pacifier and kind of show you why I do not like the Open Up and more leaning toward other things. So imagine the arch of the mouth is going to shape around whatever things that you put in the mouth, okay? So if you look at this is as the arch. Now you're gonna shape around that. You see how much of a collapse of the arch is around these little things versus something like this, the Nook. This is the Nook and this is the mom. You see how much flatter they are? And I especially like the Nook because what it does is it makes the tongue go up higher and it's a lot flatter. So the tongue has to work to go up to that spot. So it's minimally interrupting that process versus this, where the tongue is barely have to move at all in order for this to start pressing on that spot. So again, be very cautious about using a pacifier at all. If all possible, if you need help, we do have a video that I will link below on how to break oral habit. I do not recommend oral habit to go longer than 5 months old. And this is very early, which is very important that you break the habit. The sooner the better, because first of all, your child is not going to be too addicted to whatever oral habit it is. And second is it does enough damage to bone growth that is irreversible. Young mom already know so much about why they need to breastfeed. It is healthier for the child nutritiously, and it's healthier for the child emotionally because it does develop all that pathway. But it is also very, very important for your child for the correct encouragement of correct skeletal development. So that is very, very important. The number one thing is the swallowing pattern. The swallowing pattern is very important because it does cause a lot of issues when a lot of these kids come to me where you see a lot of crowding on the bottom or overjet or TMJ issues. This mostly comes from their swallowing pattern was not established correctly. You do not develop a correct pattern of swallowing until 1 month after birth. So during this time, you are learning to solidify and create a correct pattern of swallowing through breastfeeding. I am not against bottle feeding as supplement, but if you guys can, try to breastfeed as much as possible because this is important for your child to learn this pattern on there, so then they have a much healthier growth. Breastfeeding also helps promote healthy airway. The reason why is, first of all, they learn the pattern of suck, swallow, and breathe. It teaches them how to breathe through their nose effectively. On top of that, it will help create stronger upper respiratory muscle. When they are doing that swallowing pattern, they create this tension, so it's exercise this upper respiratory muscle. So then therefore these muscles will help them getting acclimated to breathe through the nose a lot more effectively, especially when they are falling asleep. Breastfeeding will play such a long-term effect on their growth and development. Especially if you or your husband has issues with airway, your child would have a lot more of a tendency of not being as optimal to breathe through the nose well. So by promoting breastfeeding, it will help your child kind of overcome those odds a little bit more. So if you can, try to breastfeed as much as possible. Nowadays, about 95% of my patients, usually around 16, I have to recommend them to have their wisdom teeth taken out. And this has happened for multiple generations. We start seeing more and more. So why do we have wisdom teeth if we don't need them? So we actually have them in there because we did use them. But because we are no longer having harder diet, our jaw is shrinking over time. And when our jaw is shrinking, we are not making room for things. The rate right now is 95% of kids will need braces. And a huge part of that has to do with we are not promoting our jaw growth at the rate that it should be, because we are not getting that hard diet in there to help increase bone mass. The best example of this would be for if you guys have someone in your life that going through osteoporosis, and usually this happens with women. And the first thing that the doctor will tell that woman to do is go ahead and exercise with weight. So weight promotes bone growth. And without weight, without increased pressure, your bone will not grow. And this plays the same concept with harder diet. When they eat harder diet, that will help that bone improve. So the reason why we are talking about this during infancy is because of these pouch feeding. So this is the thing that, as most young mother will have when you are out and about. This makes life so much easier. However, the consequences of this is it's no longer teaching your child to learn how to chew correctly and by promoting bone growth. So if you have to, use this very minimally, because you do need that harder diet for better bone growth, better room for your teeth to come in, and healthier bone structure. Brushing teeth with your child is a very important concept that we like most parents to do with their children. So like everything else that your child is learning, all type of habits, they learn from you. So when they brush with you, they will learn how to do it correctly. They won't rush through it. And this is something that we always tell every parent, especially when we start seeing that their child having some issues of rushing through things too fast, is you don't have to brush for them from the age 8 on and up. But if the more they can brush with you, and the more they understand how to slow down, they will learn how to be an engaged brusher. This is something that seems very simple, but this is a very important concept that you can help your child to be a better brusher. The next thing we would like to talk about is being aware of how your child is breathing. So what I mean by that is a lot of time, most parents will have their child as early as 6 months sleep in another room, which is great. But what it does is it doesn't allow you to pay attention. What is your child's like sleeping at night? And that's very important. We want you to be aware of how they're breathing. Are they a mouth breather? Are they snoring? Snoring and mouth breathing for more than 3 nights a week is not normal. That happens, we want you to make sure you talk to the pediatrician. And the reason why we push it very young is because the sooner you can diagnose the issues, the much easier it is to try to help fix the issues. And also the solution to approach solving that problem is a lot easier, a lot less complicated, rather than just going to surgery. So we want you to help you to advocate for your child's health, but when they are sleeping, usually that's when you don't pay attention. This is the time where you do need to know about that, because this is where they are the most prone to not breathing correctly. So if you can, once in a while, kind of check in your in on your kids and see, are they mouth breathing? Are they snoring? Are they tossing and turning? Have difficulty with that? And if that is the issues, please talk to your pediatrician about that, because we want you to help advocate for your child to be as healthy as possible. Sleeping is extremely important for your child during the stage of development. Most kids nowadays do not get enough sleep, or if they do be put to sleep, it's too abrupt and they have a hard time falling asleep. So there is such thing as what we call sleep hygiene, by creating the right environment to promote your child to go into that sleep a lot easier and sleep longer. So certain things as kind of create a calming routine where your child can knowing this is a time that we are about to go to sleep, for the melatonin to be promoted a lot more, and also trying to avoid screen time, because screen time does affect the way that internal clock is being created, because ultimately sleep does a lot of health benefit for your child during growth and development. And dementia is on the rise right now. And with dementia, a lot of that has been tied back to the lack of sleep, because the brain can only clean itself during a deep sleep phase. And when your child is not getting that stage or enough of the deep sleep, they will build a lot of gunk in their brain, and that will lead down the line for dementia. So not just with that, there's have been so many research that tie the lack of sleep to so many different health issues, and it's very similar to obesity. So we want you to make sure you create an environment to help your child to sleep better and sleep longer.